Good day, everyone. I'm Kyle, and I'll be discussing the P process. The P process is a powerful and structured model used to design advocacy and communication strategies that actually work. This framework has been used worldwide in health campaigns, community projects, and even in political education initiatives. So, whether you're advocating for policy change or promoting healthy behavior, the P process offers a systematic guide that can help you plan more effectively and make a real impact. So, think of the P process as your Google Maps for advocacy. It shows you where you are, where you need to go, and how best to get there using a systematic, participatory, and evidence based approach. So, what is the P process? The P process is a five-step communication planning framework developed in 1982 by Johns Hopkins University. And even though it's over 40 years old, it's still widely used because of its adaptability and effectiveness. It was created for social and behavior change communication, or SBCC, which is about using communication to change attitudes and actions that affects people's health and well-being. So what makes the P process special? It helps planners move from just having an idea to actually making an impact. So imagine you're trying to advocate for mental health awareness among the youth. Instead of just printing flyers, the P process would have you explore what the youth think about mental health. It will test your messages and it will help you adapt them to their culture, language, and experience. So, why should we use this process? Because it's not just about giving information, it's about transformation. The P process helps make our advocacy participatory, meaning that it involves the community. It is evidence based, which means that we don't just rely on opinions, but on real actual data. And most importantly, it's behavior driven. This ensures that our strategies lead to actual changes in attitudes or actions. So, for example, if you want young people to avoid vaping, you can't just say don't vape. You need to understand why they do it, what influences them in their behavior, what messages they will listen to. So that's where the P process comes in. The P process, being a five-step framework, of course, contains these five steps. Number one is inquire. Number two, design strategy. Number three, create and test. Four, mobilize and monitor. Five, evaluate and evolve. So these steps help us from research to action. The cycle ensures that our campaign is research driven, carefully crafted, and improved continuously. So it's like baking a cake. You research the recipe, that is inquire, and then you plan what are your ingredients, that is designing. And then we bake a sample and let people taste it. That's create and test. After that, you serve the final version, and that is you mobilize. After that, you'll ask for feedback to improve next time, and that is evaluate. So these steps are not always linear. Sometimes you need to go back and forth, but together, they will help build effective communication. So the first step is to inquire. Your purpose is to deeply understand the issue or problem you're addressing through a combination of research, data analysis, audience understanding, and stakeholder mapping. So this step answers our fundamental question: what is going on? Before we jump to solutions, we need to examine the root of the issue. Many campaigns fail because they assume too much. The inquire phase prevents that by anchoring our work in reality. So you start by collecting formative research. What are people doing now? Why are they doing it? What do they believe in? What prevents or motivates them to change? So this can include surveys, focus group discussions, key informant interviews, desk reviews of existing studies, and environmental scans or stakeholder analysis. One more thing is that you need to look at the structural barriers. This includes policies, resources, or logistics. We have cultural factors like norms, language, and traditions. So you need to create a problem statement backed up by real evidence. For example, if you're working on adolescent reproductive health, you might discover that young people are aware of contraception. However, they don't use it due to the fear of judgment from health workers. Parents and schools avoid the topic. And lastly, health services are physically inaccessible or have inconvenient hours. So these insights would actually shape everything else that will follow with our plan. The next step is design strategy. Its purpose is to build a strategic plan that aligns our goals, audiences, messages, channels, and metrics into a coherent communication effort. So this is what we call the architectural phase. You now move from raw insights to the structured decisions. For example, you need to define the smart communication objectives. What do you want people to do? Do you want to increase the STI screening among 18 to 25-year-olds by 30% in 6 months? Another thing is, what are or who are the primary and secondary audiences? Who are we trying to talk to? What influences them? And then, what is our key message? What are we trying to say? Are our messages clear? Is it too emotional? Is it empowering? Is it memorable? What could be the channels that we are using? Is it online? Is it face-to-face? Mass media, theater, church? It depends on the habits of our audience. We have timeline, budget, human resources, and then in this part, you also need to start your monitoring and evaluation plan. How will we know that we are actually succeeding with what we're trying to do? So this step blends creativity and strategy. We're trying to tailor the message to the audience's values, literacy level, and culture. So for example, let's say we're promoting disaster preparedness. So what can we do? So for the target audience, let's say women ages 30 to 50 who are the primary caregivers in the family. And then what is our message? Ang kaligtasan ng pamilya mo nasa simpleng paghahanda. What could be our channel? Radios, community meetings, Facebook parenting groups. And then what is our objectives? Our objectives should be by December, 60% of mothers in our barangay will have emergency go bags. Okay, so that is the second step. Now, moving to the third step, we have create and test. Its purpose is to develop and refine communication materials based on real audience feedback. So this is what we call the production phase. We create content, either it's posters, videos, drama scripts, social media cards, or even entire events. But the crucial part here is the pre-testing. The pre-testing involves presenting our draft materials to a sample of our audience before our official launching. So what do we observe during this situation? Do they understand the message we wanted them to receive? Is the language appropriate for them? Are the visuals appealing and relevant? And lastly, are there unintended interpretations? So after listening from their reactions to their responses, we will refine the materials. We need to revise it until it will fit our target audience. So this process ensures cultural appropriateness and message clarity, which are essential when it comes to behavioral change. You also involve creative professionals and stakeholders to co-develop the content, especially kapag yung trust is an issue. So for example, you're developing a video about mental health, and then you will be pre-testing it with college students, and then you find that the tone is too clinical and feels judgmental. You found out that the students prefer peer-to-peer storytelling over expert voiceovers. So what will you do? You adjust the script so that it will include testimonials from actual students and use language that is more conversational for them.